So for this week on CyberSchool, we're going to be covering CyberData and healthcare. We use our products a lot in the healthcare industry, and just like most industries, a lot of people need paging and access control, but healthcare is kind of an interesting niche where even I'm surprised at different use cases and different applications for different products in specifically the healthcare industry. There really seems to be a lot of unique use cases for our products in this particular industry, and I kind of wanted to highlight some of the ones that we've done, some past products that we've done special modifications for, ways that you can modify products on your own to be able to facilitate those types of things, and different things that you can do with it, and just kind of some cool use cases that we've gotten from different hospitals over the past couple years that I really just wanted to highlight. So that's kind of what we're going to be going over today. So with paging in healthcare, paging is important in so many different industries, but it's vital in the healthcare industry just due to the nature of, say, hospice care or even just standard hospitals. If there's an emergency going on with a patient, that paging system and overhead notification system is absolutely crucial. So the nurses and any doctors or surgeons know exactly what's going on immediately. And with that, the capability of knowing and the reporting on that paging system is absolutely crucial to know if anything goes down, because this is a make or break part of the healthcare facility. And not having a paging system or having a paging system that goes down and not knowing that the paging system is down can be very disastrous to not only just the day-to-day business of the hospital or whatever healthcare industry we're particularly dealing with, but could actually lead to potential loss of human life and other potential issues. So a paging system is absolutely crucial for the healthcare industry. And with building on top of that, just things like access control and just simple intercoms for two-way communication is absolutely vital. And slightly different use cases as compared to, say, what a school would use or a regular, 9-to-5 business would use our products. In the healthcare industry, they can be a little different. But with paging, just kind of like as standard like you would get in most facilities and most other use cases, the overhead paging just allows the staff at the particular location to alert patients, to let them know, say, okay, this particular patient is out of surgery, they're ready for visitors, just to let people know about regular visiting hours, say if visiting hours is almost up, so that way any visitors need to get ready to leave, or to give out different emergency events to staff, so that way they know if, say, for example, there's a blue light issue going on and they need to get, an EKG machine to, some room to, help restart somebody's heart or different things like that. So they become super crucial with that. And visual notification also ties in with that. As anybody that's watched a lot of our cyber schools, that I'm a big proponent of visual notification. It's super important when you're dealing with just any pages in general, because there might be loud noises that are going on or areas where hearing protection is required. So people might not be able to hear the visual notification. But in the healthcare industry, that's still common. You're still going to want to have a big blinky light kind of at the nurse's station in case, the nurses are chit-chatting or they're a little busy, just because that big blinky light on the wall, when it's blinking red, that means there's an emergency and they need to go deal with it. But it can also be really useful in other areas of a hospital. Say, for example, a surgery ward where somebody's going through and, surgeons are doing surgery, say, heart surgery or something. You might not want a, loudspeaker or one of our horns in a particular area like that. And if an emergency notification goes out, it could be a little startling. And you really don't want to startle a surgeon when they're doing heart surgery or brain surgery or what have you. So visual notification might be better in those areas where, a big blinky light on the wall could start blinking, red or green or blue or hot pink or whatever colors you want, to allow those surgeons to know, hey, something's going on. I should have one of my staff or my helpers go out and talk to somebody on the phone and bring us that information. So that way nobody gets startled and there's no potential issues that could arise from the paging system during that particular surgery. So this is just kind of one of the interesting ways that our products can be used slightly differently in the healthcare industry as compared to other industries. But intercoms are another great example, specifically our video intercom, which of course anybody that's been, very familiar with our products knows that our video intercoms are really outdoor only rated products. They only come in our standard, stainless finish where we really designed them for outdoor use. But in, today's world, when we're dealing with the current pandemic, they've really kind of come to use in the indoor environment, especially when they're paired with different accessories. Because of that stainless steel finish, it makes them very easy to clean and sanitize in between use. So we've actually seen a pretty dramatic uptick in inquiries and even purchases of these video intercom for use in patient intake rooms, where patients can come in and talk to the video intercom and they can communicate. There could even be a nice little big screen on the wall, so that way they can have a conversation with the doctor or any nurses that are just doing the basic intake, and that way any of the staff don't have to potentially be contaminated if somebody has COVID or some other potentially contagious disease. There's a lot of interesting use cases for our products, specifically for the healthcare industry. But when you're talking about a paging system for the healthcare industry, there's always the big weight of, do we go IP or do we go analog for the paging system? And we've, of course, got different options to tie into either. You could do a full IP-based system, which is honestly the way that I would lead you based on today's discussion, but analog is another alternative, although they've got kind of their cost and their benefits to it. IP can be a little bit more expensive, but you get a lot more benefits with it. And while analog is a little bit cheaper, you don't get that reliability and the redundancy from an analog system that you would get from an IP-based system. And since these paging systems are absolutely mission critical, knowing and being able to trust in that emergency notification system is absolutely crucial. And that's one of the nice things that you get with IP-based speakers that you can't necessarily get with an analog-based system. And that's things like health checks and then event notification, where our devices can send out messages to, say, a dedicated server, or just run their standard health checks to be able to just say, okay, this speaker is operational, all in these different tones and frequencies. The speaker checks out and it's working functionally. That's just something you cannot do with an analog speaker. I mean, you could do it, but it takes, probably a team of people where some guy's sitting there and playing a tone through the amplifier, and you got to have staff walk through to every speaker to make sure sound is coming through that speaker. It's just not really practical. And with IP-based speakers, it's something that you can schedule, and you can just go and periodically check on each individual speaker. Okay, how's that health check doing? Are these speakers still working like they should be? Do I need to replace anything? Is something not operable? Are they even on the network? That's all kind of checks and capability that you get with an IP-based speaker that you can't get with an analog that you can't get with an analog system. But analog systems are cheaper, so it's kind of a give and take there. It's what features do you want, and really for a healthcare system, I always preach to all the different customers that I talk to, and even the different reps that I talk to when I'm doing training for other platforms, is for a healthcare environment, even if it's just something small, like just like a regular doctor's office, an IP-based system is just so much more reliable as compared to an analog system, because you have that reporting capability built into all the different units. But you get other nice benefits with it. It's not just like, oh boy, my speaker can play a message and knows the speaker's working. Oh boy, that's the reason I'm going to go spend, an extra whole bunch more money on an IP-based system. There's more stuff that you get with that than just strictly that thing. Zoning capability is a lot easier when you're dealing with IP-based speakers. In comparison to, say, an analog system, you're kind of at the leverage of the speaker system that you're using and the amplifier that's tied into that speaker system. If all your speakers are tied into parallel and there's only a single output from that amplifier, you've got one gigantic zone, and that's not really good if you need to do zone paging. Whereas with any of our products, or most IP speakers in general, they support multiple different multicast zones, which makes the zoning capability much, much easier. You can have specific groups, say, for your main hallway speakers, especially in areas where you might get visitors, or patient intake areas, kind of that, waiting room that, we've all seen. Some of us have actually been to in person, where, you're just kind of hanging out. They've got, some TV on in the corner with the subtitles on, and they're playing some crappy waiting music in the area. That's something you could do with our speakers. Of course, you can do that with analog speakers, but you've got that easy zoning capability in there where they can not only be used for those kind of broadcasts, but you can tie them in to other feature sets and other just kind of cool use cases that we'll talk about a little bit later as we get into the presentation. But the other nice thing that you get with an IP system as compared to an analog-based system is we're using open protocols for this notification. Things like SIP and Multicast are open protocols. They're supported by just about every standard IP PBX, whether it's something on-premise that you would use, say like 3CX, or if you'd use something hosted, say like RingCentral, Zoom, or Cisco WebEx as an example. You've got a lot of different capabilities to go and tie into our products on just about any platform, because we're using these free and open source protocols to be able to go and generate these notifications. Whereas analog-based systems, especially the bigger enterprise level ones, stuff that you can see in schools and stuff that you can see in healthcare facilities, especially big hospitals, usually have some kind of proprietary special sauce built into it. So that way, when you go and you buy this very expensive, very cool, very, very useful Valcom system, you're stuck with that Valcom system because they're the only company that makes hardware that can interface with it. If you need new speakers, they got to be Valcom speakers. And then down the line, it gets harder and harder to find parts for it. Whereas if you go for an IP-based system, since we use these open protocols that are supported widely in the VoIP industry, our stuff can translate and be used on a whole bunch of different platforms. So you get a lot more reliability and future proofing out of an IP-based system that you might not get with an analog-based system. So now that we've kind of covered the reasons that you would want an IP-based system, let's talk about the paging speakers that you can use. And first, we'll talk about our SIP speakers. We've got two different variations of our SIP speakers, basically either with TalkBack or without. And the main difference that you'll see here is the 011394, pictured kind of right here, front and center, doesn't have the little microphone insert, whereas the 011398, the TalkBack speaker, you'll notice has a little port right next to the upper right screw hole there that we have up in the top corner. That's actually where the microphone is located. So it gives you that talkback capability, of course, if you opt for the talkback speaker. And with that, if you have the talkback capability, you get that health check already built into the unit. So that way you can go and schedule it at a particular time, which could be, say, every day, once a week, once a month, or at your discretion, you can go and have the units run this health check where they'll go, and it takes about 2 minutes or so, maybe about 3 minutes to go and play a series of tones and record those tones back with that onboard microphone and be able to tell the general health of the speaker. And these tones are anywhere from very low frequency tones to high frequency tones. So that way you're clarifying and ensuring that not only will the standard vocal range be able to play through the speakers, but if you're using the speakers for, say, background music in that waiting room, you've got that capability, and you'll know that the sound level should be good through all of your speakers. And the nice thing with these SIP speakers is we've got a whole bunch of different mounting options available for them. The main mounting options that we'll typically use are either our ceiling tile drop-in. That's a regular 2x2 ceiling tile. I didn't throw it on here in terms of an image because everybody knows what a ceiling tile looks like. It's a regular 2x2. It's not some weird 1x1 or anything like that. It's a regular 2x2, so it looks like a regular ceiling tile that you would, see in a drop tile ceiling. But for places where you don't have a drop tile ceiling, we've also got great wall mount options that we have pictured here. Part number 011152 for our standard angular wall mount. It's a really nice option. It's very nice, easy construction. It makes installation really easy. But if it's kind of an area where you might have the general public waiting, or maybe around a nursing station where having a clock is also very important, you can go for our wall mount with a clock kit, part number 011154. So that way you can tie in both that emergency notification and being able to tell the time. So you get all that nice capability with it. But we've also got other accessories that you can tie into it, like our strobe kit. The strobe kit is really useful, and that basically takes a single endpoint that would just be used for voice paging. You can go and make an announcement from it. But it also ties in, instead of buying a full-fledged, what we call our SIP strobe, you can get one of the accessory strobes and plug that into the speaker, and then anytime that the speaker plays a sound, the strobe can also illuminate. And you get different colors and different blink patterns that you can set per different group or notification that the speaker would potentially play. So if somebody makes a direct SIP call to the speaker, it can illuminate a single call. Say if it's a talkback speaker and the nurse station is calling that particular speaker, say the break room to get all the nurses out because they've been taking too long on their break, it can illuminate one color. Whereas say the speaker that's in a different area, it gets that multicast emergency, we got a code blue. The strobe could actually illuminate blue if you wanted to do that. So you get a lot of capabilities, and the strobes can illuminate different colors because we use an RGB LED panel in there. So you're not really limited to specific colors. You can pick just about any color you want. There's no lenses or changes that are necessary when you're dealing with these speakers. So these are really, really versatile, great options for when you're needing to do paging. They've got a lot of other capabilities that I'm not really touching on. Things like the adjustable volume wheel that you'll see there, very useful. Things like the analog speaker. These things are really, really awesome. And if you're more curious about these speakers in general, we've got different cyber schools that talk about these speakers more in depth. But next we get to one of our newer product ranges, and these are our multicast speakers. And these speakers are great to pair with the SIP speakers because the SIP speakers provide a little bit more individual addressability, and plus they're just generally bigger speakers with a higher powered capability, so they can just produce more sound. But if you need what I typically refer to filler speakers, things like say in a hallway or in that waiting room that I've been discussing at length now, these speakers are great options because they don't have, of course, the SIP capability that you would potentially need, but they've got that multicast support. So they're great for areas like hallways or places where you wouldn't need that individual addressability, meaning you're going to pick up a phone and dial an extension of a particular speaker. If you just need speakers to basically play a notification, again, say in that hallway or in that main waiting room, these are great options. They're a little bit lower price as compared to our standard SIP speakers, so they're very economical. And they honestly look pretty good as compared to, say, other speakers that you can see out there that kind of look a little techy, a little bit more industrial. These look like something that you could have in your home, especially our wall mount option. They mount like a standard surround sound stereo system where they've got a nice little bracket that mounts to the wall, and they're adjustable with 2 different points. So it gives a really nice clean look, and they produce a good level of sound. These are really great options and great economical options if you want to go and just add in a little bit more paging capability. These, of course, since they are kind of a lower price point option, they don't have some of the nicer features that you would get with our SIP speakers. For example, that health check that I've been really talking about, these speakers are not capable of the health check because they don't have that onboard microphone. So just things to consider as you're going through and looking at all of these different options and speccing out a paging system. But paging systems, again, aren't the only thing that you need for these notifications. Visual notification is just so important. And we've got full dedicated, these are the SIP strobes that I was referring to, not the ones that will actually plug in and be driven off a speaker. These ones are they're full own IP-based devices, where these ones will get a standard Cat5 or Cat6 cable. You'll plug them into the network. They can register with your phone system if you want, and they provide all this illumination capability that you would expect. The visual lights and blinking lights are super duper important and very attention grabbing. So they can be useful in places like the nursing stations, and also in the surgical suite, like I was talking about earlier, where you don't really want those surgeons to get startled when they're working. So having that nice big blinky light on the wall gives them the capability, without getting startled, of still getting those notifications. And we've got both indoor and IP66 rated ones. So if, say, for example, you're putting stuff into a surgical suite, you might be a little bit worried about sanitation on that. The IP66 rated one is absolutely perfect for that because it's got that nice stainless finish to it. It's really easy to put in there, and it's completely sealed. It's IP66 rated, so if for some reason things get a little messy in that surgery, you could literally spray that thing down with a hose and you got nothing to worry about. So we've got a lot of options for dedicated visual notification that are very, very useful in the healthcare industry. Next, we get to the intercoms. And there's really 2 different types of use cases for intercoms in the healthcare industry. You can, of course, go for the patient rooms, where they can just provide an easy way for 2-way communication in a patient room, or in the exterior area where they're used in the standard access control scenario, like you would have probably expected from a lot of our other cyber schools where we've talked about these units. In the patient rooms, we're mainly using, of course, our indoor rated units, our standard indoor intercom, part number 011211, or our emergency intercom, basically the exact same indoor intercom, but red instead of white. So that way you get that nice just, popping visual of this big red intercom on the wall. Really easy for anybody to see, and they'll know if there's an emergency. I press that big call button. And the part number for that one is 011209. These are great units for patient rooms, just because they provide that easy wall mount capability, so you don't have to tear up the patient room as you're doing the installation. Really nothing you have to mount in the wall. They're standard exterior wall mounts. They're not flush mounts or anything, so you don't have to cut holes in drywall. They're really easy to mount. As compared to, say, our outdoor intercom that I talked about a little bit earlier, this one is a standard wall mount, but we do have a flush mount kit option. So we've actually had a lot of different doctors' offices in particular go out and purchase for their patient intake room, so that way they don't have to potentially contaminate any staff to people that are coming in and complaining of symptoms that may mean they have COVID. And that gives them that nice capability where they can see the patient and they can just have that nice two-way conversation with them and be able to assess the situation and determine if any staff needs to go into that room and what level of protection that particular staff might need as they go in there. But then we've got our exterior intercoms, which are used for kind of the standard use case that we always talk about intercoms, where they're two-way communication and access control for areas. So you might have, say, specific staff entrance that might need, say, a key code entry where it's a little bit more protected, and you could use something like our SIP outdoor intercom with keypad, part number 011214, or just kind of a standard entrance for, say, deliveries. Maybe they don't have a big delivery dock where they have big, trucks come in and unload everything. They probably do because they deal with Cisco Foods to get all their food for the patients, so they probably have a big delivery dock, but they might want an outdoor intercom there, so that way they can just communicate with the drivers, and that way if they need to, they could wire it all up and punch in a couple DTMF codes and automatically roll up that roll-up door so the Cisco guy can start unloading all those, all those pallets of food that they have. And that intercom in particular would be our standard outdoor intercom. That'd be part number 011186. But just because you're dealing with an outdoor facility, an outdoor location, doesn't necessarily mean that you can't use our video products. You could use either the SIP H264 video intercom or the SIP H264 outdoor video intercom with keypad. Either option would work in a very similar scenario. You've got your Cisco guy, and they're just doing food deliveries, but you want to be able to see his face when he comes up. Make sure he's wearing his mask. You could use the part number 011410 for that one. Or if you want that visual capability and a keypad to be able to enter those key codes, you can do that with our video intercom with a keypad, part number 011414. So we've got a lot of different options for intercoms, both in the patient room and for exterior locations. So for intercoms in patient rooms, I wanted to do a little bit of an aside and talk about a cool custom modification that we made for one of our one of our emergency intercoms that we did specifically for a hospice care location. They were mounting these intercoms up above a patient's bed. We all kind of know those beds that they sit in where they're adjustable and they've got those big rails on their side. They're honestly kind of cool beds. I don't know if I'd want to sleep in one for a long time, but they got a lot of cool tech with them. And when they're dealing with stuff like that, a lot of those patients, unfortunately, might not be able to get out of the bed. So they might be bedridden. So they need that easy two-way communication in a general area right by that particular bed. And what this particular location opted to do was take our standard emergency intercom. I've got our indoor intercom pictured here, part number 011211. But the only difference between the two is the indoor is white, the emergency is red. No functional difference between the two. We literally used to paint them in-house. Now they come pre-painted for us. But that's the main difference between them. And the special mod that we did for them is we took basically a standard pull chain, basically something that you would use for a ceiling fan, and use that to actually initiate a call instead of the standard call button. Because if you think about where they mounted one of these things, you've got, maybe an older patient that's sitting in one of those beds, they're kind of sitting up, they're watching something on the TV. It's kind of hard for them to reach up over their head and press that call button on there. But if they've got a nice little pull chain, they can just pull the pull chain, and that acts as just like pressing the button, and that could make a call there. So we did a special modification for our emergency intercoms to actually go and mount a standard pull chain actually into the enclosure of the intercom itself. So it was a really cool use case. It really suited the healthcare industry and these patient rooms in particular. And it's always ended up being something that I've talked about when I'm talking to anybody that uses one of our products in this this type of an industry. It makes it really easy to go and integrate different ways to interact with the unit for those that might not have the capability to press that button, especially depending on how the unit is mounted. So that makes those particular intercoms, the indoor or the emergency variant, absolutely perfect for those regular patient rooms. But when you're dealing with something like an intake room where you've got people coming in and going out on a relatively, quick basis, you're not dealing with people in and out every 30 seconds, but somebody might spend, maybe 5-10 minutes in there talking to a doctor or talking to a nurse as they're trying to figure out what problems they have. One of the protocols that the nurses have to do after discussing everything with that particular patient is go in there and sanitize the room and make sure that everything is nice and prepared for the next person that would go into that intake room. And that's where our outdoor video intercom and the flush mount kit really shine. And that's because the stainless steel capability, especially with the flush mount kit, makes it a nice big flat surface to be able to go there and clean with your standard alcohol wipes or any sanitizers that you're using, because the non-porous, the non-pitted material that you'll kind of get from our indoor intercom, they're powder coated, so they've got a little bit of a texture to it, as compared, not like, say, like a popcorn ceiling. It's not like that kind of a level of texture, but it's got a texture compared to it, as compared to our outdoor units, which just have that nice stainless steel style to it. Something like you might see on a refrigerator or a dishwasher. They just have that nice stainless steel on it. And then when it's paired with the flush mount kit, it makes it really easy to just go through and wipe the unit down and make it clean. And the CDC has stated that both copper surfaces and stainless steel surfaces are absolutely great for reducing the transmission of COVID over surfaces because of the texture of the metal. And that's all science. I don't have a degree in medical stuff, so I'm just trusting them there, but they say the surfaces are really good for that. So it's a really different, interesting use case. We've seen a pretty big uptick with these particular products over the past year and a half or so with the current pandemic. But let's talk a little bit more about how to make your own pull switch intercom. Of course, you can buy it from us and request that we do it. There is, a minimum order quantity and all that kind of stuff that goes with it. But with our products, once you buy it, they're your product and you can do whatever you want with them. You might void your warranty, not in this case, but you can basically do whatever you want with the product. And this is how you would wire up and basically make your own pull switch intercoms. The standard pull switch that you could get, you can go to just your regular hardware store, whether it's Lowe's, Home Depot, Ace Hardware, Osh, basically your regular home improvement store. They'll have these different pull switches available, and they're mainly used for ceiling fans. And you basically pull it once and it completes the circuit in there. You pull it again and it opens the circuit. You don't want those fancy ones that have multiple pulls to it for, low, medium, and high. You just want your regular pull string switch where you pull it once and it's on, you pull it again and it's off. And the main way that you would go and actually wire one of these is using the remote sense inputs on our screw down terminal, which would be pins 7 and 8. With our picture here, they would be the left two most pins there. So right by that big red number 8, it would be that pin, and the one just to the right of that is where you would actually wire it in there. And then once it's wired in, as soon as you go and pull that particular pull chain, it'll close the switch. It'll close the switch actually in that pull chain itself. And to the intercom, it's just like you press that front call button. It treats it exactly the same. So it provides a really easy capability to go and basically build your own pull switch intercom capability that you get with basically off-the-shelf hardware that you can get at just about any hardware store for very cheap. I think when I was looking at it doing research for this, I think I found some from Home Depot that were, I think, $1.34 a piece. You can probably get more at volume, but super duper cheap. You're not breaking the bank to do anything like this. But the one caveat that I would pass to anybody that decides to go and make their own pull switch intercom is you really want to find a good way to go and mount that particular pull switch in a place that it would be easily accessible for any of those using it. And the way that the switch itself is mounted is when that pull chain is pulled, it's not going to pull on the screw down terminal here, because you have to think if somebody's going to be pulling that pull chain, that the effort of them pulling is going to go through the actual switch itself where the pull chain connects to, and the wires from the pull chain are connected physically to the circuit board. So if somebody goes and really yanks on that thing, you could potentially damage your circuit board. So if you're going to go this route and install your own pull switch, you really want to make sure that you're mounting this pull chain in an area to reduce any strain that could come to this onboard terminal. So this is a really kind of cool way that you could go and integrate and build your own pull switch intercoms. Of course, we're happy to do it for you at CyberData, but you do have to meet a couple minimum order quantities if you want to go that route. But we're happy to do it for you if you like. So now let's talk a little bit more about kind of other cool use cases for paging systems. We've talked a lot about intercoms, but paging systems have a couple different ways to actually go and use them. Of course, you've got your standard, announcements that you can make, and you can do scheduled announcements via stored messages, or even the bell scheduler that would be built into our paging server. You could say automate messages, say every half an hour to just play a regular COVID reminder to say your waiting room or any areas where you would have, non-patients and non-staff, visitors, just to remind them, maintain your 6 feet distance, wear your mask, all that good stuff that, we've all just kind of come to get used to. But you've got that kind of capability built into it, but you've also got the stored message feature for messages that you might not need to play on a regular basis. These could be things like, say, just general staff announcements. Say if you've got a staff huddle that you try to do regularly every morning to talk about any big things that are going on. But it's not, say, at a particular time. It's not at 8:30 every day on the dot. Sometimes it's 8:25, sometimes it's 8:35, sometimes it gets pushed to 9. You couldn't really go and use the bell scheduler to do that because you're not doing it at the same time. But if you use it as a stored message, you just simply call the paging server and dial the paging group that's associated with that message, and the unit will play that message via multicast or its analog outputs to whatever hardware you have set up to listen to that. So it provides a really easy way to do that. But that same mechanism that you would use for, say, general announcements or notifications in the location can also be adapted to kind of cooler things, because unfortunately hospitals and hospice care places in particular they're not fun, they're not exciting to go to, they can be kind of depressing. I mean, you're going to a hospital, people get sick at hospitals. Unfortunately, there's loss of human life at hospitals. There's unfortunately hospitals can kind of be a downer. So any chance that you can get to just provide some happiness and some enthusiasm about stuff at the hospital, you should definitely take it. So I wanted to shout out 2 particular hospitals that have been using our products. Anderson Regional Health Hospital has a really cool use case where they'll take our standard paging server and have the paging server play lullabies for every newborn baby that's born. And then for the babies, as they're waiting before they're ready to go home, they've used their paging system to go and play these lullabies to the kids. So it provides a really cool, easy use case for them to go and just provide that kind of normalcy to the kids, and then be able to celebrate with the patients and all the extended family of when that baby was, officially born. All the guys are standing out there, patting each other on the back, getting their big old cigars ready, and they get to listen to that awesome lullaby that just got played because their kid has been born. But Mount Sinai Hospital over in New York has another interesting use case, and this one has been a little bit more recent, of course, with the current pandemic. And what they've been doing, especially because they're in New York, they've been really hit by COVID. So they really wanted to celebrate any time that a patient actually recovered from COVID and was able to leave. Unfortunately, there were people leaving in one way, but when people were leaving under the good circumstances, they really wanted to celebrate that. So they were using their paging system, using our paging server to play Here Comes the Sun whenever a patient recovered from COVID and was actually able to leave and was cleared. They successfully beat the disease. So the nice thing with these paging systems and things that you can do with our hardware in particular is, of course, the emergency notification and all the standard things that you would think of with a paging system. But they also have really cool use cases and things that just can make people smile. And that's something that you can't always do when you're at a hospital, because they can just be kind of a downer to go to a hospital. Nobody looks forward to going to a hospital. It's one of those inevitable things that we know we all have to do at some point. You just you do it. So if there's those little chances that they can go and take our paging system and our paging hardware to go and provide that, I really want to shout that out, because I think that's a really cool use case for our products in general. So let's talk about CyberData and healthcare together as we kind of summarize everything. IP paging is absolutely crucial when you're going to be dealing with a healthcare system and any potential healthcare clients that you might get, because a healthcare system has a lot of mission critical items to their entire facility, and the overhead paging system is absolutely crucial to that, which is why I always push people to go for that IP-based system, because you get that future proofing, reliability, redundancy, and the health checks if you opt for our talkback speakers to know that that system is up and running and there's no faults with your units on the network, which is absolutely crucial for something like this. IP paging systems are really versatile and future-proof with their support of basically open source protocols using SIP and multicast. They're standard protocols that just about any off-the-shelf IP-based device or any multicast, or excuse me, not multicast, any IP-based VoIP system, your SIP system, your SIP servers, as so many people call it, our stuff is going to be future-proof because we support all of these open source protocols. So they're really easy. Say if a few years down the line you're on one provider and you switch to another, you can probably take all of your existing hardware with it because of the support for those open source protocols. And they've got a really customizable feature set where not only can we go and add new features, and that's something that we do relatively regularly, but IP-based products are just so much more customizable than an analog speaker, because all an analog speaker can do is you provide it power and it makes noise. That's all it does. Where our stuff can do so much more because it's IP-based. It's basically got a little computer in there that can make it do all sorts of other stuff while still making noise, the main thing that you want a speaker to do. And the nice thing with our stuff is our products are really adaptable to any situation with off-the-shelf parts, because we don't really lock down any particular interface on our units, especially with our screw-down terminals that we have either on our intercoms, our strobes, or our standard SIP speakers. It gives you all that capability to adapt your hardware to different situations, whether you want to go and add a pull chain, or you want to use the onboard relay of an intercom or say an office ringer to go and trigger a bigger whirly-bird strobe. You've got a lot of capability to go and tie in and adapt our products to any situation with basically off-the-shelf parts. You don't necessarily need to go and buy all this special proprietary hardware that we might offer. You can do a lot of the stuff and really customize and adapt your paging system to anything with nearly off-the-shelf equipment. So it makes CyberData a perfect choice for healthcare.
Thank you for watching this edition of CyberSchool. If you have any questions, please get in contact with our sales department. They are available by email at sales@cyberdata.net or by phone at 831-373-2601 extension 334. Please make sure to like this video and subscribe for more content like this from CyberData.